Good morning, ladies and gentlemen, or I really should say good day and good evening, since this is a global webinar, Tailoring Taxes to Health Risks, a discussion of comparative practices. As you see on your screen, we have some of the world's leading experts on public health and on excise taxation. Today, we are going to be talking about differential taxes. The area of excise taxes or excisable goods is in the middle of rapid innovation and transformation. The questions we want to explore today, as these products change, how are the excise tax regimes changing? As we see new products enter the marketplace, whether it be how do you tax cars and driving, as cars transform from burning fossil fuels to running on electricity, or as we think about taxing sugary drinks, well, we're seeing the composition of soft drinks going from added sugar to no sugar. We're seeing beer, a category that we haven't seen frankly in the past, but the increase in consumption of no alcohol beer. And then, of course, in the area of cigarettes, we're seeing a rapid switch of consumer preference from combustible, burning cigarettes to those with less harm, such as vaping products, e-cigarettes, and heat-not-burn products. And the question is, how will the regulatory regimes, how will the tax regimes keep pace with this rapid innovation? And how will governments who have become dependent or certainly comfortable on the excise tax revenues from these products, as the products transform and may not fit into the normal categories, what will they do for substitution of revenues? So these are a series of vexing questions, very interesting questions for both public health and public finance. And we have the world's leading experts to help us explore them and start the process of coming up with answers. And I say that because we know how public policy works. There's not an overnight answer, but it's an understanding of the facts. It's an understanding of the science. And I hope through this type of collaborative process, the outcome will be fact-based policies that reflect the reality of the changing products and the changing consumer preferences. Today, we are gathered for 90 minutes. We will respect your time and we will stop promptly at the conclusion of our 90 minutes together. We want this to be interactive. We will have brief presentations from each of our panelists, whom I will introduce in a moment. And then we will have at least 30 minutes for question and answer. If you look at the bottom of your screen, you'll see Q&A. Please submit your questions through that function. I will be monitoring them. My colleague, Aida Urekli from the Foundation for a Smoke-Free World will also be monitoring them. Now, let me just give you a summary introduction of our distinguished panel. Professor Sybren Knausson. Sybren is Professor Emeritus at University of Maastricht. He also has an academic appointment at the University of Pretoria, and he has been recognized by his government and the Queen of the Netherlands with a Knight in the Order of the Dutch Lion. Sybren has written the book on excise taxation, published by Oxford University Press in 2005. Excise Tax Administration and Policy has been widely published in, I know, Chinese and a number of other languages, and that is often referred to as the Excise Tax Bible. And Sybren has taught all over the world, Harvard, NYU, University of Florida, and throughout Europe, and of course, his appointment in Pretoria. Following Sebrin will be Hafiz Chaudhry, who has over 30 years experience in tax policy and administration operations worldwide. He began his career as a UK tax inspector, so he's seen it on the front lines. And then he shifted over to policy and writing at the distinguished International Bureau of Fiscal Documentation. Hafiz currently serves as an advisor to the United Nations Committee of Experts on Taxation. He recently completed a very interesting project as the general editor of a book on transfer pricing. Hafiz also advises UNDP and the World Bank. Elizabeth Allen, former head of the Division of Excise Taxation at Her Majesty's Revenue and Customs. And Liz, with the career spanning 35 years, you were there when it was still called Customs and Excise. And what was particularly interesting in our discussions of how you had interagency task forces to look at the taxation, the fighting of illicit trade, the public health on alcohol and tobacco, so reaching to all parts of your government. And then upon your retirement, upon her retirement, she has worked extensively in Africa for the Southern African Development Community, doing a comprehensive excise review, doing a comprehensive view on how to fight illicit trade. Similar projects have been undertaken by Liz in Nigeria. And of course, she is the author of a widely disseminated book, The Illicit Trade in Tobacco Products and How to Tackle It. Phil Gambaccini, a longtime friend with over 20 years experience as an international business advisor, specializing in indirect taxation. Phil wrote what perhaps may be one of the first pieces, at least in the practitioner's literature, a paper published by Tax Notes International in 2014 about how to tax electronic cigarettes. Phil was the creator and serves as the publisher and editor of vaporproductstax.com, vaporproductstax.com, a website devoted to these reduced harm new products in the tobacco space. And I would be remiss if I didn't, I would be completely remiss by not introducing Don Kenkel, professor at University of Cornell. Don is a leader in the public health field, a leader in the public regulation field, and has recently completed a tour in Washington as the chief economist to the Council of Economic Advisors. That is a very distinguished position with a very distinguished council. And Phil and Don will talk about the holistic approach of regulation. Tax is just one of many regulations affecting excisable goods. And Don will share his views on the broader approach. And in doing so, also introduce the concept of cost benefit analysis, which is critical for any regulation. And lastly, I would be remiss if I just didn't give a nod. She's not a formal panelist, but she was the brain trust behind this. Aida Urekli, principal economist at the Foundation for a Smoke-Free World. Many of you know Aida from her 25 years working with the World Bank and the World Health Organization. And in these capacities, she has worked with over 50 governments on excise taxation. So without further ado, I would like to turn it over to my dear friend and colleague, Professor Sebrin Knosson. let's see. I wonder if Sebring fell off. Let's just look, let's pause for one moment and I think he may have dropped off. So Hafiz, I know it's a little bit of a departure from our planned agenda, but if I could turn to you, and in the meantime, I will see what happened to Sebring.
Certainly, we are missing the context of overall excise design and good principles of excise design, which Sebring was going to raise. But perhaps if we can have the slide up and I can just talk through some of the broader principles. So the issue that that Sebring was going to cover was in terms of the economics of excise taxation. There are certain principles of what excises are for and what they are not for, and the principal idea is about capturing the negative externalities to take the external cost and build that into the price. So I will take that as a kind of starting point and introduce the idea that that a good excise system design should, along with that broad principle of capturing external costs in the tax, should look to certain principles which are, to some extent, they are in tension with one another, and we will explore that during the panel discussion further. But basically, the proposition I'm putting forward is that a good excise system should be directed at driving consumption towards less risky products, so that that in terms of capturing the negative externality, we should take into account the degree of harm caused by that particular product and adjust the risk proportionate piece of it, so that the tax is proportionate to the degree of risk in the product. At the same time, the excise design should deter illicit trade, and there is a tension between those two subjects, as well as the third point, which is about that governments have become reliant, especially in developing and emerging countries, which is where most of my work is. Excise is a not insignificant part of the government's revenue take, and more importantly, it's a very reliable level or proportion of government revenue, whereas something like the corporate income tax may shift from year to year depending on economic conditions, because demand for goods such as alcohol and tobacco in particular, but also motor fuel, is to a large extent inelastic. The proportion of revenue, the amount of revenue coming from excises tends to be fairly stable and tends to grow to some degree with increased consumption, and that is a factor of population growth and so forth. So, because governments have have become reliant on excise revenue, and it is important to ensure that the overall tax take is not disrupted beyond a certain amount, beyond a tolerable level. So those are kind of factors that to some extent are in tension with one another, because if you have the formal policy of capturing everything, you will be discouraging consumption and therefore reducing revenue, because that is a factor that you have to take into account. So based on that, if we accept that proposition that I'm putting forward, that tax policy has to be risk proportionate, has to be adjusted for degree of risk, there are certain things to consider. How do we implement that? And that is, first, you've got to identify all the forms of consumption of a particular harm good. And current tax systems sometimes don't do that, or they apply the level of taxation in a very disproportionate way, depending on where, depending on the nature of the goods. I have worked extensively in Myanmar, for example, where, just to give one example, country liquor, which is brewed from palm, from a form of palm, is taxed almost at zero. Palm toddy is taxed almost at zero, whereas alcohol, traditional alcohol from a distillery, is taxed at a very high rate. So there is lack of proportion in that. So the first step is to identify the different forms of consumption and to identify the level of taxation of current goods and current consumption. And then the next step, I believe, is you've got to measure the potential level of harm from consumption of different types of those of the harm good. So you may have tax incidence that applies in a very different form, at a different level, from basically what is fundamentally the same thing. It is alcohol or sugar or tobacco, nicotine, but it is taxed at a very different levels. And that, to my mind, is getting the data right before you can do any adjustment for degree of harm. And then I believe the next step is to establish some degree of some idea in terms of the appropriate target tax incidence, what level certain different forms of consumption should be taxed at. And you've got to be also aware of the demand effect of policy, that if you make certain policy choices, you're going to influence behavior, and that may shift consumption patterns and therefore tax take. So you've got to kind of look at that as well. The conclusion from that I've had is that there are no standard approaches, that you've got to really examine the condition in a particular country to understand their consumption patterns and so forth, and to carry out appropriate studies for that. And based on that, design a solution for a risk proportionate tax policy. And the final point, policy is not enough. You've got to align those with the administrative measures and how you implement the policy. So I'll stop there. Dan, I went on a little bit longer than planned, but because
that's okay, Hafiz. Thank you, and thank you for
back.
being agile on your feet. Professor Knosson is back. That he froze up and had to resign. So that's we have two of our experts sitting in Europe. Three of us are in North America. So we're in the world of Zoom, and I think all of us have been frozen at various times. So Sibrin, if we can hand it over to you. Hafiz introduced the concept of risk and a proportional tax. But let's go back to the fundamentals of excises that I think all of us need to be reminded again. We have a certain romance and love affair and think that tax can solve all of our problems, but I think we need to be reminded on on what are the fundamentals of excises.
Thank you very much, Dan. After your compliments at the start of the meeting, I concluded that my presentation could only be a disappointment. And apparently my laptop agreed with that and conked out on all of you. So I apologize for that, but that's all part of the game, I guess. I'd like to make some introductory remarks about excise taxation, and I would like to invite the Evan to turn the slide for me. And that's the case for excise taxation, which I'm going to make. Please continue. And here we are. Excise duties are easy to collect, of course, because there tend to be few producers. Demand is inelastic, volume of sales is high, so they are great revenue raisers. They cause few economic distortions because demand tends to be inelastic. So what we call as economists, the excess burden of taxation is low. The most important is that excises correct for market failure. When we smoke, drink, gamble, pollute, burn fossil fuels, consume sugar, etc., we impose costs on society in the form of health costs or other costs that climate change, etc., which are not accounted for in price unless we impose an excise. So the excise is a proper way to correct the consumption or production of these products for failing to be sold at a proper market price. And for the same reasons, excises can also correct for individual failure. When you consume too much sugar, you harm your health, etc., and the excise can account for that. And the next slide, please. The external cost argument, meaning that if we consume or produce these products, we impose physical or financial or psychological costs on other people in society, means that we can estimate these external costs, divide them by the number of packages of cigarettes consumed, by the liters of alcohol consumed, by the liters of gasoline burned, etc., and arrive at an appropriate price, tax price, excise that is, which would internalize these external costs. So a specific rate is superior to an ad valorem rate. And with a specific rate comes the ability to apply physical controls, which tend to be more feasible than accounting checks in controlling excise tax compliance, etc. Let's have some examples of excise duties. There are a host of them, and they tend to increase. So please, Evan, turn the slide again. We have tobacco, of course. We have drinking. We have games of chance, where you impose external cost on your family because you gamble away the money, the family budget. We have sugar, of course, that has come to the fore in recent years as an important cause for sugar consumption, for obesity, etc., which of course causes health costs, etc., and which, if the insurance does not differentiate for it, are borne by other people in society. Plastics is pretty much the same. The world is now drowning in plastics. We all agree on that. Then there's classic case for transportation, which has multiple externalities with cars, roads, waterways, etc., where the external cost should be internalized in the price through the excises too. And of course, that includes fossil fuels. Finally, there are luxury products, which are not really an excise in the sense that they cause external costs, but they try to increase the progressivity of the tax system. I've drawn some conclusions from my work on excise taxation, and Evan, I invite you to turn the page again. And on tax policy, I think excise duty should be raised to efficient levels. And efficient means that the level of external costs, so that the excises pay for the external cost. Most excises, by the way, don't do that. So there is a case for increasing them further. But that's not necessarily a revenue maximizing level, because that might be even higher. And that's the level where an additional percentage increase in the excise rate leads to a equal decrease in revenue. That's the revenue maximizing level. But the efficient level tends to be lower than the revenue maximizing level. I strongly recommend that we focus on external and internal effects. So these costs which we impose on other members in society, rather than on consumption, which is sort of a paternalistic attitude, or effects on the income distribution. Even people who burn fossil fuels, with people with low incomes who burn fossil fuels, should be faced with the full price of the liter of gasoline, which should include the climate change contribution, of course. And I believe that we should include positive internal effects, meaning that even if you account for all the external effects, you may still harm your own consumption or those of your family members, and we should include those in evaluating the burden distribution. Finally, and a very important point, because that's probably what some of the questions are about, if there are substitutes for these potentially harmful products, that means tobacco, alcohol, sugar, plastics, fossil fuels, etc. If there are substitutes like e-cigarettes or 0% beer or lotteries, which are not really very addictive because there is quite a time span between the time you buy the lottery ticket and the time you may receive a prize, pure fruit drinks, paper bags instead of plastic bags, sun and wind energy instead of fossil fuel energy, then these harmful products, these substitutes for the harmful products should only be taxed if they cause demonstrable external and internal costs. Otherwise, we should simply apply the VAT and not an excise. Or other, stated differently, if the government still wanted to tax e-cigarettes, other considerations enter into the debate other than external costs or internal costs. Then I have the last, next to last slides, please, Evan. That's on administration. It's always important to include imports in the domestic tax base, so apply the excise to imports as well as domestically produced products, and apply the VAT to the import duty and excise duty inclusive price of the excisable products. Tax physical quantities, not values. We already dwelt on that. Importantly too, correct the specific rate for increases in the general price level, in inflation, and that is a very important point for developing countries where inflation may be in the range of over 10%, something like that. Apply physical controls, we dwelt on that, of course, and then I end with the point which Hafiz has emphasized, administrative points, that we should confront illicit and small-scale production, and importantly, that the regulations are very important as complements to the excise duties. Now, finally, I have some, turn the page, please, some recommendations for further reading. The first article was published in the Journal of Economic Perspectives, the most respected journal in the economics profession. That's a very good analysis of a tax on sugar sweetened beverages, on soft drinks. And then there are two books which I wrote on excise taxation for domestic for theory and practice of excise taxation and excise tax policy. And most lately, July, paper on excise taxation for domestic resource mobilization in light of the COVID crisis, the increasing debt levels of countries and the high budget deficit levels. Thank you very much for bearing with me, and I turn it over back to Dan Witt.
Well, thank you, Sibrin. I think you have laid out and reminded us of the foundation of excises, and also your takeaway slide, I think, set the table very nicely for Professor Kenkel to talk about other government options in the areas of regulation compared to taxes. Hafiz, do you want to make a point or two, and then we'll get over to Liz? I thought you might want to reinforce one or 2 points following Sibrin's presentation.
Well, I think I did open with that in terms of the only thing I would add, I suppose, is in terms of calculating that external cost, I would reinforce the idea that we need to measure the degree of cost and perform some kind of risk adjustment in trying to capture that external cost in the price. And I think we can talk about the balance because there are issues around appropriate excise tax structures, around whether you aim for a purely specific system, which is the purest and accurate way, but then that has some tension with a risk-adjusted approach. But I think it's better to reserve that for the panel discussion.
Good. And one other thing, just to alert my panelists, my colleagues, all too often you have governments say they can't show the public health link on soft drinks. You often hear this, and then the government officials say, "Well, we need the revenue." So if our panelists could be ready to discuss the theory of revenue grab. Liz, if you could share with us the experience in the UK. The UK has always done a very deliberate, careful approach, an all-of-government approach, listening to the health community, the health department, the treasury, the consumers, the manufacturers, regardless of is it alcohol, tobacco, soft drinks, food, or in petrol. If you could share with us the UK experience. I know with respect to soft drink tax, they have a graduated schedule. No sugar, no tax, higher sugar, higher tax. Similarly, there've been some pioneering work done in the area of reduced harm tobacco products in the UK. So please take us inside the UK and share those experiences.
Thank you very much, Dan, and thank you to the Foundation for asking me to speak today. Good day to everybody around the world. At first, I would like to pick up on a few points made by both Hafiz and by Sibrin. I certainly agree that excise tax policy should, as far as possible, facilitate excise administration and thus revenue collection. And yes, I agree with Sibrin that specific taxes are best because there can be no dispute about the weight or strength of a product. However, nowadays, tax administrations usually adopt risk-based compliance audits using data analysis of accounts and records together with risk and credibility techniques. It's still useful, of course, to carry out some physical checks on premises security, equipment and stocks, including of raw materials. Also useful are unannounced checks outside normal working hours to assure compliance with the law and procedural requirements. After all, if someone is going to be producing and distributing goods off record, they aren't going to be doing it during normal office hours, are they? It's now feasible to carry out remote computer audits, and legislation permitting, have access to real-time production and stock records, as well as to records for imports, exports, losses, etc. And I mention all of these because I am aware that in many countries around the world, the assurance and audit procedures are not quite as advanced. But I think that is the future. The future also perhaps will include supply chain controls, which we can expect to be replaced by blockchain for large-scale global movements of goods and access to the purchase records for key inputs to the production process, as well as for the sale of waste products. And these can allow comparisons of purchases with declared outputs. And turning to the slide, which I hope Evan will put up for you, let's look now at UK tobacco products excise taxation, as mentioned by Dan. You can see that tobacco for heating is taxed at a lower rate than cigarettes, cigars, hand rolling tobacco. And as Dan says, there's been strong collaboration between our Department for Health, Her Majesty's Treasury, and Her Majesty's Revenue and Customs over the last decade and longer in determining tobacco tax policy and rates of tax. So when the Public Health England produced a report in 2018 with evidence that the tobacco for heating was significantly less harmful to health than tobacco products that burn when being smoked, it was decided after consultation with other stakeholders to apply differential taxation. So we now tax the heat not burn products at a lower rate than traditional cigarettes to reflect the comparative harm in the product and encourage committed smokers to substitute to cheaper, less harmful products. And please note that using the same evidence-based rationale, e-cigarettes are not subject to excise taxation in the UK because the health experts have argued that they do not contain harmful carcinogens and should therefore be free from excise tax in order to encourage addicted smokers to substitute to vaping. E-cigarettes, tobacco for heating, and traditional tobacco products are, of course, all subject to value-added tax at the current rate of 20% ad valorem. That's on top of the excise, as Sebren mentioned. And all the products where VAT is based on an excise, the excise inclusive price, are charged when they leave the tax-free production or storage regime. And just to illustrate how attractive the savings are for someone's switching from traditional cigarettes to e-cigarettes, the price of one of the e-cigarette products, Heat, is £5 for 20, plus the initial cost of the device of £49. So if someone smokes 10 a day, he or she will save £1,000 a year if they switch. That's almost $1,400 US. So it's a lot of money, especially for someone in reduced economic circumstances. And I'd like to mention the rationale for having a mixture of specific and ad valorem tax structure for cigarettes. Well, that's a relic of our EU membership and may now be subject to revision if other priorities for change in legislation permit. Prior to our membership of the EU, cigarettes were subject to a specific tax rate only. And in my opinion, our current tobacco tax structure can be improved further by having a single high rate for all traditional tobacco products, rather than having different rates for cigars and hand rolling tobacco. In my work in emerging economies, I've also come across tax regimes that apply an either-or tax rate on tobacco products, with tax charged at either a specific or an ad valorem rate, depending on which calculation gives the higher revenue result. Now, to my mind, this not only makes life more difficult for officials, but also for businesses who have to make two calculations instead of one. And of course, the more complex the tax, the greater the likelihood of mistakes, genuine or otherwise. Finally, I would urge governments to consider simplifying their tobacco tax structures, applying differential taxation so that smokers who either can't or won't quit have the opportunity to save money by switching to a lower taxed and less harmful heat not burn product, or to even lower, much cheaper, nil-taxed e-cigarettes, rather than opt to move to the illicit market when traditional cigarettes become unaffordable. So for that reason too, to reduce illicit trade in tobacco products, I would hope that people will switch to the cheaper, less harmful product rather than try to buy cheaper products that come from the illicit market that have got no quality assurance and can be even more damaging to health, but also provide profits to international criminal groups and even terrorists. So I'll leave it on that note. Thank you.
Thank you, Liz, and we look forward to the question and answer period. I think a lot of our viewers are very interested in learning more about that whole of government approach that you've been able to put in place, this differentiated regime, and that it has been a consensus view of health, public finance, industry, and consumer groups. And that's quite interesting. And also how it has changed consumer behavior. Phil, it would turn to Phil Gambaccini to hear about how reduced harm products are being taxed in the European Union.
Okay, thanks, Dan. I'm going to describe the framework for taxing tobacco in the European Union. And then I'll discuss what's currently happening at both the Commission and at the various member states. Could we see the slides, please? The tobacco taxation in the European Union is regulated by this Directive 2011/64 EU, which sets up a group of rules and procedures for taxing manufactured tobacco products in each of the member states. The object of this directive is to promote the internal market, to make the internal market behave like a single market, and to protect the health of the citizens of the European Union. Now that's achieved through keeping the prices high through taxation. Now, in order to achieve these objectives, there are certain things that the directive provides. And one is harmonized product definitions, so that a cigarette in one country is identical to a cigarette in another country. It conforms to the same definitions in terms of length of the rod. For fine cut tobacco, for hand rolling cigarettes, there's a definition of the width of the cut of the tobacco leaf in order to qualify as fine cut tobacco. So these product definitions are very important, and they are harmonized among the various member states. The excise tax structure is somewhat more flexible. The member states are required to have both a specific tax and an ad valorem tax, but the range is very wide. So it's possible to have virtually an entire specific tax or a largely ad valorem tax. So you see within the member states a tremendous variability in that tax structure, in that mix of the taxes. And there was also a required minimum tax rates. Now, this is where the member states do harmonize the minimum rates. So according to this directive, there is a minimum rate of 90 euros per 1,000 cigarettes, or 60% of the weighted average price of cigarettes sold. All of the member states must have tax structures which reflect this minimum rate. For fine cut tobacco, for hand rolling cigarettes, there is another minimum rate, which is slightly less. It's 60 euros per kilogram. And for other smoking tobacco, it's even lower. It's 22 euros per kilogram, or 20% of the retail selling price. Now, what we see is that these are harmonized, but not on the basis of harm reduction or risk profile. The harm reduction products, such as e-cigarettes and heated tobacco products, are not addressed in this directive. In 2011, these products were not very plentiful, so they were not addressed at all. Smokeless snus, which are these little pouches, little like tea bags of fine cut tobacco, which are used orally, are not included. And even though they have a lower risk profile, they are banned in most of the European Union, the exception being Sweden. Now, the Commission is required to review this directive periodically to make sure that it's up to date and it reflects conditions within the market. The last time this took place was in 2017, 2018, and the Commission decided not to amend the directive. At that point, harm reduction products were not so widely available. Very few member states applied excise taxes at that time. And there was an observation that with heated tobacco products, which were just coming onto the market at that time, these were novel products with multiple formats, and it was difficult to come up with common definitions, which is necessary in a harmonized tax system that we have in the European Union. So basically, those issues were highlighted, but no action was taken to include them in the directive. Now, the situation has changed a lot since 2017 and 2018. What we see in 2021 is that 17 member states have already introduced special categories for heated tobacco products. And other countries where heated tobacco products are sold, they have classified those products under the other smoking tobacco or pipe tobacco categories. And those are much lower than the cigarette categories. E-cigarette sales have been growing considerably in the European Union as well. And today, 14 member states have excise taxes on e-cigarettes. The next slide, please. Now, member states are adopting differential taxation based on risk profiles. They're not waiting for guidance from the European Commission. Now, though Liz mentioned the evidence review that was commissioned by Public Health England just a few years ago, and I would like to read just very quickly one sentence from there, which says that the available evidence suggests that heated tobacco products may be considerably less harmful than tobacco cigarettes and more harmful than e-cigarettes. So what that report does is establish a continuum of risk and with combustible tobacco cigarettes on one end and e-cigarettes on the other end. So it's a guideline in a sense for differential taxation. And that has been followed by most of the European Union member states. In fact, I've done some analysis of this, and what I see is that heated tobacco products are taxed approximately 70% less than cigarettes, and e-cigarettes are taxed at approximately 90% less than traditional cigarettes. But as Liz pointed out, in some countries, there is no tax on e-cigarettes. And those differences are clearly driven by health policy and by the evidence provided through the studies that have come out from organizations like Public Health England. Now, the Council of Europe, of the European Union, which is the body that represents the member states, has asked the Commission to conduct another review of the directive They're currently going through that process. And they are looking at this challenge of harmonizing the definitions and tax treatments of novel products. The minimum tax rates, which is emerged as a problem, according to the Commission, they find that these rates are too low, and there's a feeling that those rates need to be increased for all of the various tobacco products that have defined and harmonized minimum tax rates. So that process is going on. A report is being prepared. At the same time, the Commission has initiated a public consultation, which goes through the month of June, in which they are soliciting stakeholders' input on this issue of taxation of harm reduction products. So this will allow various groups, operators, the trade, other parts of government, NGOs, to provide input to the Commission on how these harm-reduced products should be taxed. But there's no guarantee that those inputs will actually affect the policy. And there's no guarantee that the Commission is actually going to take action to include harm-reduced products in the directive, or another option would be to create a separate directive just for harm-reduced products, but there's no guarantee that that's going to occur. Most likely what will happen is, if there is not a definition or a revision of the directives to include these reduced harm products, the member states will continue to maintain the differential taxation approach, which they have adopted over the years, without regard to any directive coming from Brussels. So that's how I see the situation at this point in time. Thanks.
Well, thank you, Phil. And when we have the question and answer, I'd like to follow up on that continuum of risk and having tax level determined by that risk. Well, we've heard from a series of distinguished public finance and tax policy and tax administration experts. Let's open our minds to the broader field of regulation and turn to Professor Don Kenkel. And Don, I failed to mention that the recently published, or not so recently, but the Handbook of Health Economics, you wrote the chapter on prevention. So you're bringing it in a very interesting perspective as a public health person and looking at broader microeconomics beyond just taxation. So over to you, Don.
Thank you very much. Yes, as we've been hearing a lot this morning about, or this day, about how we can tailor taxes to health risks. And we've been hearing experiences across the world. But I want to provide not just the kind of global context, but actually more about the policy context, to think about put taxation in the broader picture of the policy tools the government has. Can you start sharing the slides, please? And as I'm doing that, I'm also going to be talking some about cost benefit analysis, as Dan mentioned, where I think this is a chance for academic research, public health research, economics research, to provide the evidence base for evidence-based policymaking. In my time in DC, I hope saw a lot of that, to see a lot more potential for that to happen. So to think about these policies more broadly in the regulatory area, I mean, taxation, as we've heard, has some very strong appeal. In particular, it's a very nice solution to the market failure of externalities. And we can impose a tax that addresses the external costs that are imposed by the consumption of goods like tobacco, but also like lots of polluting goods, plastics, and so forth. At the same time, we get revenues from them. And so this seems sort of like we have get our cake and eat it too, that we both address a public health problem and we get revenues. But the one thing to keep in mind, of course, is that trade-off, as always, there are trade-offs. And in particular, if the tax is very effective at reducing consumption, then it actually can reduce revenues. And if other public policies reduce consumption, they'll reduce revenues. And that's a good thing. We have to keep in mind that when we're thinking about these public health problems, that we don't want to be gaining a lot of tax revenues necessarily. We'd rather get rid of the bad consumption that's causing the problems, and that'll be better for society overall. And more broadly, is the important question is to use the right policy tool for the job and to really think about other market failures as well as just external cost. One of the most important market failures, I believe, in the health risk area is information. That people do not have enough information to make the best choices in their own best interest, and providing that information is an incredibly important way for the public sector to help the private sector. One of the most fundamental ways to do that is to provide the research. But then beyond the research, then once there's a research base, there can be these public health campaigns. And the anti-smoking campaigns of the last 50 years provides, just a textbook example of how information plays this role in public health. That in the 1950s or so, the evidence began to accumulate that smoking had all these terrible health consequences. That was sort of officially recognized in the 1964 US Surgeon General's report and similar reports in other countries. And this launched a decades-long public health campaign. In the United States, the smoking rate fell from 40% in around 1965 to 14% in the most recent data. A few years ago, my colleagues and I published a paper in the Journal of Benefit Cost Analysis that quantified the success of that public health campaign. And we came up with the estimate that the present discounted value of the benefits of the reduced smoking were worth $500 billion, over $500 billion. And this is just a way of quantifying a point that Professor Ken Warner of University of Michigan School of Public Health has made, that the anti-smoking campaign of the last 50 years is probably the most successful public health campaign in the OECD, the US, and the EU over that time period. The importance of information when we think about products like the harm reduction products is underlined by the fact that consumers regrettably lack information about these products. In the US Health Information and National Trends Survey, over half of consumers think that nicotine is the main ingredient or the main component of tobacco smoke that causes cancer, when nicotine has nothing to do with cancer. It's the other combustible generated products. It's the tar in cigarette smoke that causes the cancer and most of the other health effects. In fact, a more recent survey finds that 80% of MDs think that nicotine is related to cancer and some of the other health consequences. And again, that's just not the science. Regrettably, again, this carries over to the harm reduction products. And so in the most recent hints, this Health Information National Trend Survey, over 35% of consumers think that e-cigarettes are more harmful or much more harmful than combustible cigarettes, where again, all the available evidence is that they are much less harmful than combustible cigarettes. And we've been doing some research here at Cornell, published, for example, in the Journal of Risk and Uncertainty, that suggests that this is that some of the misinformation about the harms of e-cigarettes was exacerbated by the outbreak of lung injuries that were actually related to the use of THC containing vape products, not nicotine e-cigarettes, not commercial e-cigarettes. So the potential for information to improve consumers' choices is a very important policy tool to be used in conjunction with taxes and other ones. I also mentioned in the slide here, of course, that we also have lots of both general consumer product regulation and prescription drug regulation. And one way I think about those types of regulations as basically synergistic or complements to information policies, that with consumer product regulation, we know consumers know what they're getting. And so they know that there hasn't been anything adulterates added into an e-cigarette juice, or adulterates added into food, or that the car you drive is safe to drive. All those types of things make the private sector markets work better. In addition, sometimes regulations can be very useful as targeted bans to approach specific problems. We might want to ban the sale of certain risky products to young people. Or we might want to ban the use of risky products in places where they generate external costs. So we ban smoking indoors. And those, again, can be very useful adjuncts to other policy tools. At the same time, though, we want to be careful about overuse of those types of tools. And we don't want to be banning attributes, for example, as a way to try to sort of force people not to consume a product that might be otherwise in their best interest. So banning attractive products like attractive attributes like flavors, which many smokers who use e-cigarettes to quit like flavored products. Banning flavors does not help and probably hurts public health. Next slide, please. So I'd just like to conclude my discussion of this sort of broader picture of taxes as one policy tool among various regulations by returning to the famous invisible hand metaphor that Adam Smith introduced in 1776 in his book, Wealth of Nations. And the main point here, I think, is that incentives created by policies, that invisible hand, lead to both intended and unintended consequences. And on the political economy side, some of the unintended consequences might be unintended by the government, but unfortunately intended by other actors. For example, the economic theory of regulation produced by George Stigler, a Nobel Prize-winning economist at the University of Chicago, suggests that regulation ends up often serving this interest of the regulated industry. And industry uses regulations to create barriers to entry. And I think we've seen some of this in the harm reduction product area, where the tobacco industry is actually happy to have regulations on some of its new competition from the newer products. But on the positive side, an appropriately regulated private market has incredible market powers. Of course, it produces goods at low cost and prices. It develops new products, and the new products developed in the harm reduction area, the electronic cigarettes, the heated tobacco products are great examples of this. And the final thing, I would just circle back to my point earlier about information, that once private markets are selling these harm reduced products, they have the incentives to help consumers, inform consumers about the potential value for these products. And I think consumers since the 1950s and 60s, smokers have wanted ways to reduce the harm that they're doing to their bodies. And many of them quit. Many more of them could be able to quit if they use electronic cigarettes and heat not burn products. And the profit motives of the private industry are perfectly aligned with public health in this case. And I'll end on that kind of optimistic note.
Well, thank you very much, Don. And I want to remind our viewers that we are very eager to have your questions. Please submit them through the Q&A function at the bottom of your panel. I'd like to kick off, use the moderator's prerogative, and ask Sebrin a question. I mean, governments are starved for revenue, particularly coming off a very difficult year due to the pandemic. So how do you see the balance between raising taxes on traditional products like combustible cigarettes as a short to medium term way to satisfy revenue needs and to provide the fiscal space for lower taxes on these reduced harm products? And will this create the fiscal space? And Because at the end of the day, filling holes in a budget often drive policy. I hate to admit it, but I think it's a reality. Well, you may be muted still.
Here we are. You can hear me now?
Perfect.
Fine. Well, answering your question is, going back to principle, excises should be raised to their efficient level, I said, and that efficient level is the excise that reflects the external and internal costs of the act of consumption or production. Beyond that, I guess, if we want to raise more revenue from excises than from other taxes, simply for revenue purposes, we should ask ourselves, what is cheaper to collect? An additional dollar of excise or an additional dollar of VAT or corporate tax revenue, etc. And when we consider that, of course, we have to take into account not only administration and compliance costs, but also economic costs. And in that respect, it may well be that excises come out at the lower end of the cost scale here. Otherwise, I guess if you need a lot of revenue, it's the VAT that you would be looking for, taxing all consumption with a 1% rate increase or whatever, rather than go for specific products. Because we also know that the distortion of a tax increases with the square of the tax rate. And obviously that since that does not apply, of course, as long as you are accounting for external costs, because they should always be reflected in price. But if you go beyond that, you have this law that if you increase the rates further, you also increase the economic costs, the distortions.
Thank you. Liz, you provided a great insight into the UK. You talked about electronic cigarettes, reduced harm cigarettes, but I know that the UK has introduced a graduated system for soft drinks. If you could share your insight on that. Again, it's a graduated scale. And in answering the question, if you could talk about how the government relied on science and facts, which are critical.
Yeah, sure, Dan. Evan, if you can find it, I've actually produced a slide just showing the taxation levels for our sugar levy in the UK. So if you could put that up, that would be helpful. So what happened with this sugar levy was that originally health experts were very concerned, and I think they still are very concerned about the level of obesity in our society in the UK. And we're looking at ways to encourage consumers to change their unhealthy habits. And one of the things that they alighted on then was the high sugar content in a lot of sodas, what we call fizzy pop. And that was deemed to be particularly bad for health because it contained a lot of added sugars. And there was a long period of consultation, about 2 years, during which time the government, in the form of the Treasury, HMRC, and the health experts, were flagging up the options of what might be done. And after some discussion, they decided that the best way forward would be to use a form of differential taxation, which was intended both to encourage consumers to switch to beverages with low added sugar or no added sugar. That's it, Evan, thank you. But also to encourage manufacturers to reformulate reformulate beverages with low or no added sugar and produce their original products in smaller sized cans or bottles. And in fact, that was actually the major success of the UK sugar levy so far. The fact that many manufacturers did choose to reformulate their beverages and to market them as healthier products with low or no added sugar. We implemented the legislation in 2018, and you can see from the slide what the position is. No excise tax at all on beverages containing less than 5 grams per 100 millilitres, 18 pence per litre on drinks with a total sugar content of 5 grams or more and less than 8 grams per 100 millilitres, and 24p per litre on drinks that have a total sugar content of 8 grams or more per 100 litres. So that was the design, and I've said the biggest success has been encouraging manufacturers to reformulate. Unfortunately, so far, it hasn't solved the obesity crisis we have in the UK. And I suspect that is because there are very many substitute food and beverage products that contain high quantities of added sugar or natural sugars, fat and salt, and snacking has become such a national pastime, as have ready meals and takeaways or home-delivered food, such as pizzas. These have all become increasingly popular during the last year or so of pandemic. So I would suggest the takeaways from our experience with sugar levy are that differential taxation is very successful in encouraging the public to stop consuming a particular sort of product if there are other untaxed, but equally or more harmful substitutes on the market. So that doesn't really apply to the discussion to the tobacco tax, differential tobacco tax, because we have already had the evidence that the heat not burn products are less harmful than traditional cigarettes, and e-cigarettes are considerably less harmful, in fact, quite healthy, apparently. So there are appropriate substitutes there. And the other thing I take away from that, our UK experience, is it's important to announce the intention to impose a tax on a product according to the harm in its content, to have the consultation with manufacturers and other stakeholders, and give them a long period for implementation so that they can work out how to reformulate their products, how to remarket them, and so on, and pack them in smaller quantities for sale. But we're still left with the issue about what to do about obesity. So I'll leave it there, Dan.
Well, Liz, let's make sure one of our takeaways is not to have a pizza tax. But in all seriousness, I think the UK tax and the way it's been designed has had a very successful impact on the supply side. I understand that companies like Coca-Cola, that the UK is the only market in the world where they're selling more zero sugar products than regular products. Now, that's a success perhaps for public health, a success for people taking less sugar in from a soft drink, but it's not raising the revenue. So again, if you think about a developing country, this is where I was saying to Sebrin, the theory of revenue grab taxation, that that the UK has a very effective VAT if it needs big money quickly, rather than looking at these piecemeal excise regimes. Just real quick follow-up, Liz, and I want to, so real briefly, we've seen the effect on the supply side of the sugar tax in the UK. On the demand side, it's been less of a success because people are not reducing their per calorie inputs because of the many substitutes that are not taxed. How about the change of consumer behavior on cigarettes? Have you been able to witness people switching from combustible cigarettes to the reduced harm products? And is price, of which tax is a driver, is the price and tax a reason?
Right. Well, yes, Dan, the price has to be a reason. I've also got a slide, I don't know if you can find it, Evan, about the UK tobacco tax receipts and e-cigarette consumption over the last few years. It does show that the last figures we have, 2019, that's right, the revenue take from traditional tobacco products has reduced, and it also shows a fairly steady rate of e-cigarette consumption. But what we have to add to that are the facts that cigarette consumption generally has been decreasing because of the awareness and the different regulations about not smoking in public areas, etc. And it's just no longer trendy to smoke. So that has had an impact anyway, that people have managed to quit. There will be other people who have decided not to go for e-cigarettes, because even with excise at a nil rate, they are still taxed with value-added tax at 20. And these people may have gone to the illicit market, which is still thriving and which is still difficult for us to manage down to what is considered to be an acceptable rate. So there are other factors involved. And I do think we need to look at the overall picture before you can come to any conclusions. But hopefully there will be increased marketing of the e-cigarettes to help consumers to determine, what is better for their health and their pocket.
Thank you, Liz. Hafiz, maybe I know you've done a lot of work in developing countries. We've got the devil of illicit trade. So what we're saying today is increase the tax and the prices of combustible cigarettes to make it more attractive for consumers to switch to reduced harm products that, based on risk, based on harm, should have a lower tax and indeed a lower price. But could that be undermined by illicit trade? And how must we be mindful of this lurking risk of illicit trade when designing excise taxes, the structure and the level?
Thanks. Before I get to the question, I'd put up my hand and I'll lower it right now. Just to respond to something that Liz said a minute ago about sugar and the availability of substitutes. This was my inventory point in my slide, that in terms of measurement, you've got to make an inventory of the different forms of consumption and look at the trade-offs that people make. So, even within the drinks category, I mean, the challenge has been that in sugar, people have latched onto purely on the fizzy drinks category. In developing countries, quite often the way sugar is consumed in liquid form, leaving aside, candy or chocolate or, something more innocuous like the sugar content in confectionery, leaving all of that to one side. In developing countries, quite often the largest form of sugar consumption is actually through fruit squashes and cordials and so forth. And because this is perceived as kind of less controlled by multinationals, just to be blunt about it for a minute, but also because quite often those products are done by national companies. The focus has been to try and tax fizzy drinks, and what you see is immediate shift towards these concentrate products and and fruit juices, fortified fruit juices, which are really a small amount of concentrate imported from abroad with a lot of sugar added to it. And you're seeing huge shifts of consumption. So that is also the demand effect point I was making, that when you, this is the demand effect of public policy. When you take certain public policy measures, you end up having some unforeseen developments. And that's something that, it's quite hard to calculate, but it shouldn't have been beyond the wit of man when you were looking at taxing fizzy drinks to also think there are other forms of liquid consumption of sugar. And why people missed out on that, I don't know. So leaving that one to one side, and I know I'm wittering on and we have to be conscious of time. I think definitely, to answer your question, Dan, you definitely have to be concerned about illicit trade. And that was what I was saying, that there's a tension between these policy choices. There's also a separate tension, which is the rate structure of excisable goods. Typically in developing countries, there is a bias, originally from ad valorem systems, but there is a bias towards certain forms of consumption. So in tobacco, consumption of bidi in India, or other hand-rolled forms of consumption, which are severely undertaxed. So even within combustible tobacco products, there is a case for those tax structures to be harmonized, but you've also got to be conscious of the realities of the marketplace and what is possible in that context. So it's a trade-off, it's a balance, and it's a marathon. It's not a sprint. So,
well, thank you, Hafiz, and one thing I take from that is a broader base, both on food and drinks, and also on all tobacco products, and that's perhaps the way to meet a revenue shortfall. Sebrin, I noticed your hand was up, and maybe we could do double duty. And we have one question from one of our viewers is, as we see this innovation and transformation on many excisable goods, what is the likely impact on revenue? And what other areas are there for governments to raise significant revenue? And I think, this goes back to VAT, but again, many conversations on, it depends who you speak with. If it's the public health people, they're focusing on the health objective. Our Ministry of Finance colleagues are worried about revenue. So in transformation, it's kind of stuck in the middle. So if you can make your point that you had your hand up, feel free. And if you could address that revenue question.
All right, let me keep that to the last. I had a few comments on Liz's excellent presentation of the sugar excise. Of course, if there are substitutes available, like sugar added to fruit drinks, etc., they of course should be included in the base for the sugar levy, and it should not be confined simply to soft drinks. And you can go to Scandinavian countries where they also tax chocolate, where they tax sweets, where they tax candies and all of that. And obviously there is a problem with illicit trade, etc., or buying in the neighboring country, Norwegians buying in Sweden, etc. But you solve that through coordination. That's illicit trade, and that's what they are doing, and that's something to be remembered, or to be mentioned. I want to say that obesity rates in Norway and in Sweden have gone down considerably since the introduction of a tax on sugar and sugary products, not only soft drinks, but other drinks as well. On soft drinks, my only comment is, and I welcome, of course, this British innovation, my only comment is that there is not a continuous incentive to innovate for soft drink manufacturers, which you would have if you imposed it on sugar only, rather than having bans of taxation, because the manufacturers have not an incentive to go outside the ban. On e-cigarettes, I think it's important to remind ourselves of this report of the Royal College of Physicians in the UK, which establishes that e-cigarettes, the external cost of e-cigarettes, the harm of the risk of consuming e-cigarettes is about 5% of the cost of regular cigarettes. So it's considerably less, and so there is a strong case for having a much lower tax. On revenue, I think if you have to go for sizable increases in revenue, we should go for a tax on consumption. A tax on consumption is much less distortive to economic growth, to saving and investment, than a tax on income or on profits. And so that's but the problem with the consumption taxes in most countries is that they have lots of exemptions, lots of zero rates, which are very, very difficult to get rid of. So an increase in the consumption tax rate, which is, say, already 20%, would lead to much more sort of evasion, avoidance, and distortions. And what we should go for is not necessarily increasing the VAT rate, but expanding the base to include products that are now all exempted. And it's very important to remember that we should not go after income distribution objectives when we impose the VAT, because we've got the income tax for that, and we have got the social benefit payments for that. We should not use the VAT for income distribution purposes. We know from very good research that for instance, most countries have a lower rate or a zero rate on food, and the rich consume twice as much in absolute amounts of food. They spend twice as much on food than poor people. So that's a very, very silly way of trying to address the problems of the poor. But the recommendation is indeed go for the general consumption tax, but go for the base rather than for the rate.
Thank you, Sibrin. And we're almost out of time, but I want to bring Don into this. So much of these issues on excisable goods, they have a public health component, and there's a lot of emotion, and you see a targeting of industries, a targeting of products, rather than the broad-based categories that will take into consideration behavioral changes and substitutes. How can we move the policy discussion to be more reliant on science and more fact-based? Because I believe that will give us better policy outcomes.
Well, that's obviously a very difficult question, of course, how to move the policy to be more fact-based, more evidence-based. I mean, I am I think that's incredibly important. I think, as I mentioned earlier, I think that's one of the ways academics contributes through cost-benefit analysis. And as I teach my students, and as I learned in DC last year, cost-benefit analysis is used regularly to evaluate federal regulations. And that's a great way, I think, for the evidence base. And the evidence base needs to focus exactly on the title of this, or part of the title of this webinar today, the tailoring policies to the health risk. And rather than focusing on an industry or a specific product, really look at the risk of the product. And so, as you mentioned earlier, that would argue for taxing all kinds of combustible tobacco at the same rate rather than differential rates. And it would also argue for, but also thinking about all those unintended consequences of, we tax sugar-based, sugar soft drinks, people find other ways to get sugar. If we tax one type We've seen this play out with electronic cigarettes a little bit differently in a regulation, that the federal government started banning certain types of flavors in the US, and people have just shifted to the available flavors. And I think that was very predictable. So we need to be thinking about taxing the products that are most harmful and taking into account the economic incentives that are created by those taxes to be sure that we're not playing sort of a game of policy whack-a-mole where we've solved one problem, but new problems pop up over there.
Well, thank you, Don. With that, ladies and gentlemen, that concludes today's webinar, Tailoring Taxes to Health Risks. I would like to thank our host, the Foundation for a Smoke-Free World, in particular, those behind the scenes, Aida, Evan, Lori. The foundation, I understand, will be putting on their website all of the slides and resource materials that the presenters shared today, and also the recording that will be available in Bahasa, Russian, Chinese, and of course, English. So with that, I want to thank our viewers from around the world and our distinguished panel. We had a very productive 90 minutes. I look forward to continuing this discussion and continuing our work together on these important policy challenges. Thank you, and have a good day or good evening.
We like to thank the chairperson for the day. Thank you, Dan.
Sigrid. Okay, bye now.